Welcome back, Pahrump. And again, this is the last segment of my show, the Independent Doctors of Pahrump, last 13 minutes or so. So if you have any burning question that you want to call in, and that number should be at the bottom of your screen, 727-8750, and I certainly welcome your call. This show is kind of live. Sometimes I prepare some slides. Sometimes we don't get to them, so there isn't too many questions that I would find too difficult, and I may even start a segment where you can try and stump me and see if you come up with something that I don't know. Of course, there's a lot of things I don't know. But that being said, when it comes to general medicine and diabetes, high blood pressure, and a lot of the diseases that affect our elderly population, I'm usually pretty good at deciphering through that. I think there were 2 slides left on the pneumonia vaccine that I could bring up, and making sure that I didn't miss any of those topics. So as soon as our producer can bring those up. Okay, so this was this is a very good slide. This was with the clinical trial of 85,000 patients greater than the age of 65, randomized to the 2 groups, meaning the Prevnar 13 versus placebo, and found a 40% decrease in vaccine-type community-acquired pneumonia and a 75% fewer cases of vaccine-type invasive pneumococcal disease. So invasive means getting it into your blood. So that was a very significant study that proved the effectiveness of Prevnar 13. So that's why, and that data, because they knew it was very effective in the pediatric population, but very effective in the adult population. And because there's so many strains, it isn't like measles, you get one pneumonia, you won't get another one. That's absolutely not true. So, and of course, and I don't know if you remember in the earlier slide, there was something about getting your spleen removed. Some people involved in automobile accidents will lose their spleen, and they become very susceptible to pneumococcal. Pneumococcal is a very strange bacteria. It's an encapsulated bacteria. It's in a polysaccharide encasement, okay, meaning a sugar casing. And that's how we can develop the vaccine to that particular bacteria. That being said, there are different forms of that polysaccharide or that sugar coating or that protein coating that's on there, and that's why they can only make so many strains. And, you know, bacteria are like, they're very resilient, meaning they're all over the place, and they will mutate and change depending on what you feed them. So that's why this antibiotic resistance is so interesting. If you think about a bacteria's lifestyle or lifespan, it could be hours maybe. One bacteria lives and another one dies. How many, if we lived a lifetime in a minute, and a bacteria is in a minute, how many evolutionary cycles would you go through in a period of 10 years? A lot. That being said, so you expose a bacteria to a particular antibiotic, it's going to survive, but there's going to be resistant strains, and those strains can pass on their resistance to other bacteria through exchange of DNA and other things. So that being said, all chemotherapy, whether it be bacteria, cancer, anything like that, selects for resistance, meaning if we had 1 million bacteria and we treated it with penicillin and it killed all but 10,000 of those bacteria, then guess what? You have penicillin-resistant bacteria that are now allowed to grow. And you're giving penicillin, and you wonder why the infection is not going away, because they say, I can take that shot, and bring it on, bring more penicillin. Doesn't affect me anymore. And that's why new antibiotics have come out. So then they change things up. That being said, if you didn't have an intact immune system, I could literally soak you in antibiotics, marinate you, and the bacteria would still overtake you. And that's a very scary thought. Like the bubble people, the bubble boy that lives in a totally secure environment within a bubble and not getting exposed to anything because he has no immune system. So that's why you start to see these diseases creeping up as you get older, is because your immune system weakens over time. Cancers are kept in check. Things develop later in life because your immune system wears out. I mean, we were not meant to live forever. And so it is very important that you start to do the right thing as far as diet and exercise and keeping those things in check, because that's your best defense against getting sick and getting an infection. And all else, really, if you let yourself get run down. I mean, I heard this horror story about 5 years ago about this guy, and the media loves to do this. He was down in Galveston, and he was in the water, and he had this huge, strange infection in his leg, and it made the news. And everybody gets scared of going to the beach. Well, if you read into the story a little bit longer, he's a diabetic with an open foot ulcer. I mean, seriously. I mean, is that the kind of thing you want to do? You're a diabetic, you already have a deficient immune system, and you're going swimming in a water that's not clean. I mean, you kind of deserve to get something like that, if you ask me. And with that being said, everybody thinks that the water is unsafe. So if you have an immunocompromising condition, it's very important for you take extra good care of yourself, and extra good care of yourself beforehand so you don't develop these bad diseases. One thing I heard recently that made a lot of sense with regards to diabetes, which is, I think, the most devastating disease you could get, is eating. When you eat, walk after you eat. If you would just walk a little bit, get up and do something after you eat, you can stem the tide. Why? Because your muscle cells are burning all that sugar off, and they're not letting it go to your fat stores. And you're not altering your total body's ability to handle food and food intake. So therefore, if you would just walk a mile after you eat, this guy who was basically giving this talk said that he went to France for some kind of cooking lessons, and he basically lost 2 pounds during the trip because he had to walk everywhere he went. And what do? We usually sit down, have dinner, watch TV, and go to sleep. I mean, no wonder we have so many obese people in the world, and we have so much diabetes. It's because we have this sedentary lifestyle that has just become a part of it. So a little bit of activity is better than none at all. A little bit of walking is incredibly important after you eat. Now, these things are, again, very, very important. I don't know if I turned it on, if you could see it, but it does light up. But it actually does, and I've said before, it actually counts the number of steps that you take during the day, and you can set different goals for yourself. And it actually lets you know how many steps you've taken, and it also will do, it's a Fitbit. There are different versions on them on the market, and I know Apple's now come up with their Apple phone. But this thing, they've gone for as little as $80, and this one was about $100 and some odd dollars. But the beautiful thing about it is that when you see that, you can actually keep up with what your level of activity you need to do. And a lot of times at the end of the day, what I will do is, if I see that, you know, I'm 3,000 steps short, it actually forces me to get out and walk and do some activity so that I can keep up that level of physical fitness, and so that I can, especially after I eat, so I don't put on more weight, because it's just easy. I had lost, I don't know, 10, 15 pounds prior to during the summer months, and I put a lot of that back on during the winter months. Why? Because I was inactive. I don't think I ate that much worse, but because I didn't have activity and I work a lot, that had a lot to do with it. So it's very important. And the guy was right. He says, I can get 4,000 steps working in the office, but that's not enough for me to stem weight gain. I need about 10,000 steps a day to really get that going. And now that the day is later and the days are staying later, you can get out and walk a little bit in this particular town. So if there's one take-home message for you about anything out of all the shows and all the things that I've done, it's just, if you will walk a mile after you eat, which isn't that far, if you can, or do anything, you will greatly help yourself and stem the tide of weight gain, and even maybe promote a little weight loss. So don't think that no activity really helps. A little bit of activity goes a very, very long way into helping yourself be fit and be better. So with that being said, we're nearing the end of the show. If there are topics that you would like for me to talk on, if there are things that are interesting to you, like Amy, particularly about that particular vaccine, if there are things that you would like to know something about, that's free to call in and let me know. and then I can prepare a little bit of slides and a little bit of talk on that subject. So just let me know if there's something that you want to talk about, and I would much rather talk about what you would want to talk about than what I would want to talk about, because I don't always know what is on your particular mind. But with that being said, I hope that you are doing well outside in the community, and that you are trying to do something to remain fit. I don't know if there was one more slide on that Prevnar 13, I think it was. Yeah, that's the reiteration of the patients previously vaccinated with the 23 valent should wait at least 1 year before receiving the polysaccharide 13 or Prevnar 13, and again administer Prevnar 13 first, and then 6 to 12 months with a minimum interval of 8 weeks. So if you're an adult and over the age of 65 and have not been previously vaccinated, this is what you need to do. Okay, till next week, thank you very much. I'm Dr. Reiner, and have a good night.